So for today's objectives, we want our audience to gain a better understanding of Medicaid and SNAP unwinding. Hopefully this will provide you all the ability to translate the information to your communities and reflect on how this will affect social determinants of health moving forward. But next up, I would like to invite Darrell to talk about why safety net policy is so important and why we are highlighting it today.
Thank you so much, Mung-Chi. Next slide. All right, so before we hear our presenters today from the policy centers, we want to take an opportunity to highlight the importance of safety net policy and how it impacts the communities that community health workers serve and the resources we, community health workers, have available for the clients and communities we serve, particularly related to addressing healthcare access and social determinants of health. A quote from the Economic Policy Institute states that public investments in safety net programs continue to be extremely effective poverty reduction tools. Government social programs kept tens of millions of people out of poverty in 2021. Because of expansions to programs, poverty rates were actually lower in 2021 than they were prior to the COVID-19 pandemic. And it's evident that relief funds were able to lower unemployment rates, food insecurity, and provide millions of people access to healthcare. It's very unfortunate to see that all the funding is being taken away without providing communities time for transition phases or alternative pathways and responses. Community health workers prioritize serving underserved and under-resourced communities because we are aware that these communities were disproportionately affected by COVID-19, and many of these disparities have been documented. During the height of the pandemic, not only were CHWs reducing hospitalization rates in underserved communities, we also assisted in providing leads and resources to help people connect with jobs that help to lower unemployment rates. As COVID-19 related funding for many CHWs begins to end, we are anticipating an increase of unemployment within the communities we serve and our workforce. This ending of the COVID-19 public health emergency will also affect COVID resources as vaccines, testing kits, and COVID-19 treatments have been free of charge up till now, but due to the ending of the funding, this access may not be free of charge, will not be free of charge. It's unclear today how much it will cost the communities we serve, but there are some public health offices that estimate that the cost might be around $180 per dose for vaccines. And we know there'll be costs associated with testing kits as well on the market without support. Please inform the communities you serve of these changes, encourage them to take advantage of these resources while they're still available, particularly for free. And also know that community health workers will continue to adapt and work to find continued resources for access to some of these needed services. Before I pass the microphone back to Mung-Chi to introduce the presenters, I just want to take a moment in history to tell you about how one of the organizations that's going to present today, Georgetown University, was very instrumental in the CHW movement. In the mid-90s, there was an organization created that was based out of the Harrison Institute for Public Law at Georgetown and the University of Southern Mississippi, and it was called CSHO, the Center for Sustainable Health Outreach. They are the creators of Unity Conference, which is still coming up. It's coming up in August. They also, the Center for Sustainable Health Outreach did many other things, but the Georgetown Harrison Law Institute also helped start the American Association of CHWs, which was our first attempt at creating a national association. So they got grant funds that went to the university. So just for people on this line who don't know, Georgetown has been involved in the CHW movement for over several decades. I now would like to pass the microphone back over to Mung-Chi. Thank you.
Thank you, Darrell, for that quick history. I know like the abundance of knowledge that Darrell has is amazing when you want to talk about the history of CHW and the workforce. With that, it's my pleasure. So next slide, please. With that, it's my pleasure to transition into our primary content for today. We will be hearing from Jennifer Wagner, the Director of Medicaid Eligibility and Enrollment with the Center on Budget and Policy Priorities. And then also from Allie Gardner, a Senior Research Associate at the Georgetown University McCourt School of Public Policies for Public Policies Center for Children and Families. So thank you.
Thank you so much, Mengxi, and thank you all for being here to hear about the ending of some of the provisions related to COVID emergency relief. So looking at the next slide, let's just take a moment to look at how we got here. The next slide here outlines a little bit about some early on legislation that was passed at the beginning of the COVID crisis. So if we could go to the next slide, please. Thank you. Great. So in March of 2020, Congress passed the Families First Coronavirus Response Act, and that had a couple of provisions related to Medicaid and SNAP. With regard to Medicaid, it required states to keep most enrollees enrolled during the public health emergency. This was in exchange for some enhanced federal funding, an increase in the FMAP that was given to states. Every state did elect this option and has kept virtually everybody enrolled in Medicaid for the last about 3 years. On the SNAP front, it allowed states to temporarily increase SNAP benefits, those became known as emergency allotments or EAs. It also allowed state agencies to implement workload waivers and suspend certain rules that restricted access during the COVID crisis. And those two provisions were essential to protecting people, making sure that they had access to healthcare and food as the world was falling apart a bit at the beginning of the pandemic. And it also allowed agencies that determined eligibility for Medicaid and SNAP. It gave them a little bit of a relief to handle the increased workload and the changes to their own operations that were brought about by the pandemic. Now, when these laws were first passed, they were linked to the federal public health emergency, the COVID-19 PHE. And they were supposed to be in effect for the duration of the PHE. Now, as we know, the PHE is expected to end May 11th of next year, but these laws were later kind of delinked from the end of the PHE, and the end date has changed. So if we look at the next slide, it talks about the Consolidated Appropriation Act, and that was passed in December of last year and made some changes to these provisions. So looking at the Medicaid side, the CAA lifted the continuous enrollment protection effective March 31st of 2023. So that means that for the first time in over 3 years, people are losing Medicaid. The agencies are conducting renewals of everybody enrolled in Medicaid over the next year or so. And that's going to lead to a lot of people losing coverage, some of whom need to transition to other coverage, and some of whom actually remain eligible for Medicaid, but are going to get caught up in the red tape. The CAA also extended and phased down the enhanced federal funding for states through the end of 2023. We're hopeful that that's kind of an incentive for states to take their time with this unwinding, with this winding down of the continuous coverage provision as they're getting additional money through the end of the year. The CAA also requires states to meet a few different requirements in order to continue receiving those additional federal fundings and to avoid penalties. So Allie will get into that a little bit later. On the SNAP side, the CAA ended the emergency allotments after the distribution of February 2023 benefits. So those February benefits went out, depending on the state, in February or March of this year. So in every state that was issuing the emergency allotments, those are gone now, and a lot of people's benefits have decreased. Now, the Medicaid provisions here we're talking about were universal. Every state opted into this, and these protections applied to every state. And while there are slight variations in the phase down and when they're going to begin terminations, that's all happening on a very similar schedule. On the SNAP side, not every state took up these emergency allotments to begin with, and a lot of them phased them down earlier. So there's a much more scattered impact. So we can see that here on the next slide that shows
Jen,
a map.
Oh, Jen, sorry to interrupt you, but can you slow down a little bit for the interpreter?
Sure, apologies. I will do my best. So this chart here shows that states that had the SNAP emergency allotments in place. So those blue states had them in place up until the February issuance from this year and have since phased them down. And the states in white had already ended them. So I'm sure you all have seen an impact in the community as people have been getting less SNAP benefits. So moving on to the next slide, I'm going to talk about a few other upcoming changes in SNAP benefits. Part of the CA or part of the Families First Act way back at the beginning of the pandemic included workload waivers that allowed state agencies to not do an interview, to not renew people as often. And those waivers will end in June of this year. And so we expect an increased workload on SNAP agencies beginning in July that could have a spillover effect to customer access. Also happening in July, states are going to resume their regular rules around college student eligibility, and they'll be applying that at application and renewal. So people won't necessarily lose coverage right away, but if they newly apply or go to renew, the more traditional rules around college student eligibility will apply. In addition, in July, the ABOD time limit will resume. This is something that limits the amount of benefits that childless adults can get to 3 months in a 36-month period. So that time limit is going to start. A number of states will have waivers of this time limit, but in states that do not qualify for or do not elect waivers, that will end. And so because this is a 3-month time limit, in October of this year, we'll see the first ABODs losing coverage due to the time limit. So that's a little bit of an outline of what's going to happen in SNAP over the next year. On the next slide, talk a little bit about how to help SNAP enrollees. First of all, do anything you can to help them to maximize deductions. As I'm sure you know, SNAP is a complicated benefit calculation that takes into account income and expenses to determine the benefit amount. Because of the emergency allotments and everybody receiving the maximum amount or above, clients and state agencies may not have been as diligent about logging in shelter expenses and daycare expenses, medical expenses. So if somebody's benefit level went down dramatically, it's definitely worth checking in with them to make sure that they're reporting all of their expenses and getting the maximum benefit amount. In addition, there are more supports that are available for people if they're struggling with food. One of the primary ones that's really heavily underutilized is WIC. So referring somebody to WIC can be another way of supporting them. We mentioned some changes to the college student exemptions. A lot of college students can qualify for benefits. If they have a child in the home, if they're working a certain amount, they can still qualify under the more traditional rules. So they may have gone in under one of the COVID protected groups, but they may still qualify for benefits. So helping them kind of sort through that and figuring out if they still qualify would be helpful. And finally, for these ABODs or able-bodied adults without dependents, they're often eligible for exemptions or may actually be in compliance with the requirement. So anything that you can do to assist them with sorting through any exemption they might qualify for, gathering the necessary paperwork and submitting that to the agency would be terribly helpful so that they don't lose coverage after 3 months. So that's a little bit about the SNAP side, but there's a tremendous amount happening on the Medicaid side. So I will turn it over to Allie to discuss that.
Thanks, Jen. Next slide, please. So as Jen mentioned, the CAA made the changes to SNAP as well as Medicaid. And on the Medicaid side, the CAA ended the Medicaid continuous enrollment protection or condition effective March 31st, 2023. And this is what we call the unwinding as states resume normal operations and get back to normal eligibility and enrollment procedures. As part of this unwinding, states must check eligibility for all Medicaid enrollees. And if individuals do not complete their renewal, they are terminated from coverage, which we call procedural disenrollments or administrative disenrollments. States must also, during the unwinding period, comply with all federal renewal requirements, as well as take steps to update beneficiary contact information and attempt to contact enrollees through different modalities before terminating them for returned mail. We know a lot of people have moved over the past 3 years, so the CAA put in some extra protections to help ensure the individual to reduce the number of potential procedural disenrollments for someone's renewal form not getting to them. The CAA also gave CMS new enforcement authority to help oversee the unwinding process and hold states accountable if they start not following these rules and procedures. States during the unwinding period are prohibited from making more restrictive eligibility enrollment standards, and are required to report in a timely manner specific data on Medicaid, the Children's Health Insurance Program, or CHIP, as well as data related to marketplace transitions. And very important here is all states are required to report the data specified in the CAA, regardless of if they choose to forego that enhanced FMAP or federal funding that Jen talked about or not. States CMS can hold financial penalties for states up to $100,000 a day if they do not comply with these data reporting requirements. Next slide, please. So just to give a scale of what states are facing and what the country's facing with this Medicaid unwinding, looking at some numbers. So currently, or based on the most recent data we have on Medicaid enrollment, approximately 92 million people will undergo a Medicaid redetermination over the next 12 months. Medicaid and CHIP enrollment has grown by almost 29% in the time period of the continuous enrollment condition being in place. And more than half of the individuals currently enrolled through Medicaid or CHIP are children. And all of these numbers are particularly important when we think about those procedural disenrollments that I talked about. According to an analysis from the Assistant Secretary for Planning and Evaluation that's run through HHS, 2.7 million adults and 3.9 million children are estimated to lose coverage despite remaining eligible for Medicaid or CHIP coverage. And unfortunately, these disenrollment figures may end up being higher in reality just due to the scale of the unwinding and the workload that states are going to be facing. Next slide, please. So as states undergo or restart these Medicaid redeterminations, there are a few potential pathways to coverage that individuals can fall into. The first and the best outcome would be that an individual is able to fully complete their redetermination and is found eligible for coverage and renewed for coverage for ongoing coverage. Another option is that someone may be found to be ineligible for Medicaid, but during the period that the continuous enrollment protection was in place, enrolled in other sources of private coverage or has access to other affordable private coverage that they can easily transition to. The yellow kind of warning would be if someone is found ineligible for Medicaid or CHIP and they need to transition to marketplace coverage because their income has increased beyond the eligible limits for Medicaid or CHIP. This is kind of a yellow because even though affordable coverage exists on the marketplace, sometimes those transitions are not as smooth as we would hope, which I'll talk about more in just a minute. And finally, as we keep mentioning, our biggest concern are those who are going to lose coverage for procedural reasons, despite remaining eligible for Medicaid or CHIP. Next slide, please. And so digging into these procedural disenrollments and why they may happen, during the renewal process, enrollees may not receive their notice. Like I mentioned, a lot of people have moved, they may not have, the state may not have their correct address, so they may never receive their renewal notice in the mail. Or they may not understand their renewal notice. We know that this has been an ongoing problem for years, that Medicaid notices can be confusing or unclear about what action is required to retain coverage. And for individuals who are non-English speakers, states may not provide those notices in their preferred language. And finally, life happens and individuals may not be able to submit their renewal information in a timely manner, especially if significant documentation is required to show ongoing eligibility. Additionally, and this is something we're already hearing about as states have started their unwinding process, call center wait times may become unreasonable as people seek help. And as a result, enrollees may not be able to get through and get the answers they need to to get assistance with their renewals. Medicaid agencies are already overloaded, and as they go through this process, they may not be able to process documents in a timely manner. And all of this, people who are procedurally disenrolled will likely reapply for coverage, which is going to result in additional work for agencies, as well as potential gaps in coverage for enrollees, both of which has increased cost as enrollees experience medical debt from services incurred during those gaps in coverage, and additional administrative costs to reprocessing renewals for individuals who are having to reapply. And this box on the left shows how procedural, this is based on the ASPE report that I mentioned earlier. And it shows how that children and communities of color are at particularly high risk of these procedural disenrollments, and where extra work is going to be needed for outreach and education to ensure that they're aware of the process that their states are undertaking. 74% of children, 52% of Latinos, and 48% of Black non-Latinos are estimated to lose coverage despite remaining eligible once states finish their unwinding periods. Next slide, please. And as I mentioned, as people do their renewals, some may successfully complete those, but are going to be found ineligible for coverage because their income has increased while throughout the past 3 years. The Biden administration has taken steps to make those coverage transitions smoother, like fixing the family glitch, as well as establishing a special enrollment period on the federal marketplace for consumers specifically who lose coverage during the unwinding. However, there are a number of challenges that are going to remain in making those smooth transitions. The marketplace does provide subsidies, but it doesn't always ensure that coverage is affordable, especially when you talk about deductibles and cost sharing and other out-of-pocket costs for individuals. Also, the marketplace process, enrollment process is the application is often complicated, and there's a five steps between the Medicaid agency transitioning someone's file to the marketplace to them officially being enrolled in a marketplace plan. So it's a very complicated plan selection process. And finally, children are likely going to remain eligible for some other source of public coverage, specifically the children's health insurance programs. But again, the right hand doesn't always talk to the left hand. And so the coverage transitions between Medicaid and CHIP, especially in states that operate what we call a separate CHIP program, may see children fall into gaps in coverage before as they make those transitions. Next slide, please. But as doom and gloom as all of that sounds, the positive news is massive coverage loss is not inevitable, and this is part of why we're talking here today, is utilizing people on the ground who can help inform people, enrollees, and ensure that people who are eligible for coverage are able to maintain it. So a couple opportunities that states have to reduce coverage loss. The first is states ensuring that their redeterminations are spread over the full 12 months that CMS has allotted states. Balancing this timeline is going to ensure that state workforce doesn't get overloaded, and that they're able to process redeterminations on a timely basis without massive workloads and backlogs. Additionally, States should be working on robust communications and outreach, and that includes working with community organizations and like CHWs, providers, other people who have direct contact with enrollees to help get the word out about the need for individuals to complete their renewal process and the changes that may are undergoing Medicaid. States that have more effective renewal processes are less likely to experience high levels of specifically those procedural disenrollments. States are required to conduct what we call an ex parte renewal or an administrative or passive renewal, where they check with existing data sources to try and determine someone's ongoing eligibility prior to sending out a renewal form. And states that are able to maximize the use of ex parte and have higher ex parte rates are more likely or less likely to see high rates of procedural disenrollments, since all that's required of beneficiaries who have a successful ex parte renewal is they get a notice in the mail saying that their coverage has been extended. So a lot less work than having to complete a renewal form and send it back in. Also, states that have worked on helping smooth those transitions to the federal marketplace, like we just talked about, are going to see less folks with less gaps in coverage and able to maintain continuity of care. And finally, states that have committed to transparency, accountability when things go wrong, and a willingness to provide rapid response when problems are identified throughout the unwinding process are more likely to see undergo corrective action where procedural disenrollments don't occur on the same scale. One thing I like to emphasize when I talk about this is the unwinding is not a one and done event. This is going to be a years-long process where the problems that we see in these first few months don't have to be the problems that we see in December or January of next year. So states really have an opportunity as issues arise early on to fix those problems and ensure that no one is erroneously terminated from coverage. Next slide, please. So what can you all do? And I think community health workers can play a really crucial role in this unwinding process because you all have a trusted relationship with community members and are on the front lines where you have direct communications with enrollees. You're knowledgeable about your state programs and available resources for individuals who may be eligible for Medicaid or have Medicaid coverage. And because you all are on the front lines directly communicating with enrollees, you're well positioned to identify problems that recurring problems that you see. And this is going to be a critical element of what we call the feedback loop, where you all can see and address problems that seem to be coming up on a consistent basis, can share that with advocates, legal aid organizations, or directly with the state so that the state can take corrective action to eliminate those problems so they don't become ongoing issues. And if the state chooses not to undergo rapid response and take corrective action, you can also help connect families with the media to share lived experiences, or just connect families with legal aid organizations who can help assist them to figure out how to maintain their coverage. And because of all of this, you all can really speak with authority on how the unwinding is impacting the communities that you work with. And very critical, since there are a number of non-English speakers who are enrolled on Medicaid, you all can help provide assistance or translation services for limited English speakers, which is something we're really concerned about that states are not doing an adequate job of providing. Next slide, please. So a few key pieces of information as you're working with Medicaid enrollees. The first key message is to get them to update their contact information with the state if they haven't already. And this particularly helping them identify ways to update their contact information. Some states have developed online portals, have ways through their call centers to update contact information, identifying all those ways so you can direct beneficiaries to the easiest way for them to update their contact information is going to be really critical. Also, encouraging enrollees to be on the lookout for their Medicaid renewals and to respond if they get one. And this is nuanced in that not everyone will end up getting a renewal form if the state does a good job with those ex parte or passive renewals. They should just, in those cases, get a notice in the mail of ongoing Medicaid eligibility. But you also want to make sure to flag for individuals to be on the lookout for renewals so they don't just dismiss whatever they get in the mail. Also, in the nuanced messaging of this, states, if they're doing a good job, should be spreading out the renewals over a 12-month process. And so not everyone is going to get their renewal form at the same time. So keeping up that consistent drumbeat of having throughout the year of having people check their mail for renewals and responding if they get one. And finally, if you do encounter enrollees that have lost coverage, for those who have lost coverage for procedural reasons, they have 90 days. They have a 90-day reconsideration period where they can re-enroll in their Medicaid coverage without having to submit a new application. And for those determined ineligible, they can help transition to marketplace coverage and helping them connect with navigators or assisters that can facilitate the plan selection process. Next slide, please. And I won't go through every single one of these since I know the slides will be made available. But there are some key warning signs that you can look for if as things may be going wrong in your state's unwinding process. Just a few examples are if you're hearing enrollees are getting terminated from coverage, but they never receive their renewal notice in the mail. If the call center wait times start increasing, that's a very early warning sign that individuals may not be getting the assistance they need. And if you start hearing that states have significant backlogs in processing of applications, that's a sign that their staff workloads may be piling up and other issues may arise as a result. And finally, if you do hear of states with large numbers of procedural disenrollments, either based on state data or stories from enrollees, that's a sign that something's going wrong in the process. Next slide, please. And so the big question I'm sure you have is, what is your state doing and what does the unwinding process look like for your state? So this timeline presented by CMS shows when each state will start procedural disenrollments across the next few months. Oregon's a little weird because it has a state law that based on timeline means that procedural disenrollments will not start until October. But other than that, most states will see procedural disenrollments or just general terminations of coverage beginning in May or June. Next slide, please. And there are a number of other resources that you can see the type of preparation and planning that your states are doing or have done related to the unwinding. The first, which is highlighted, some of the key points are highlighted here on the left, is a 50-state survey that CCF did with the Kaiser Family Foundation that shows a number of key actions that states are doing to prepare for the unwinding, including how well they are doing on those ex parte or passive renewals and how long states are planning on taking for their unwinding process. And CCF also has developed a 50-state tracker of unwinding specific information that states have been publicly releasing, which includes states' unwinding plans, communications materials that states have put out for third parties to use, and any data or data dashboards that states are publicly posting of unwinding related outcomes. And I believe those links should be put in the chat. Next slide, please. And I'll just wrap up with this, which is how can you all help? and again, you guys are going to get the slide, so I won't read the slide to you, but just to point out a few key points is reviewing your state's plan and identifying what groups will be going through the redetermination process first. So you can really figure out who in the groups that you work with need more targeted outreach in these first few months. Having a list of navigators or assisters that you can direct enrollees to for assistance as they go through this process and need help. And then if you are able or are not already participating in an established feedback loop, I know a lot of advocates and legal aid organizations have started these across most states, participating in that feedback loop and sharing information that you're hearing from enrollees of recurring problems, issues, system bottlenecks, anything, sharing that with that feedback loop so that information can be passed along to the state so they can make corrective action as those problems arise. Next slide, please. And finally, these are just a few resources. Many of these have already been shared in the chat, but as you need additional information, these are all great resources to point to for additional information. And with that, I believe I will pass it back.
Thank you, Jennifer and Allie, for your presentation. I know that was a lot of information for folks, but then again, we will be sharing, this slide would be recorded and uploaded on our website as well. And the slides and the resources such as the links would be shared. So next slide, please. So with that being said, I would like to welcome our panel of CHWs from Wisconsin. So first up, we will be hearing from Marcia Morales, who is the Wisconsin Community Health Worker Outreach Coordinator for the University of Wisconsin Population Health Institute, to kind of share what are the state perspective of SNAP and Medicaid unwinding. And then once that is, once she's finished, we will transition into Olga and Penny, who will be discussing what they are seeing at a local level with some of these policy changes. So thank you. And Marcia, you could go ahead and start.
Thank you, Mangshi, and thank you, Adriana, for just reminding us to slow down and be mindful of the interpreter. So welcome, everyone. My name, like Mangshi said, is Marcia Morales, and I work at the UW Population Health Institute and also supporting Vision. And my role there, like Mangshi stated, is the Wisconsin Community Health Worker Outreach Coordinators. One of my big focus areas has been advancing the community health worker workforce and its sustainability. And particularly, I provide a lot of support and guidance to our 2109 grantee recipient communities. So I'd love to just share a little bit about the Wisconsin perspective. And of course, this is just my perspective. There's many, and I'm so glad that we're going to be hearing from the community health workers themselves. So bringing in my perspective around all these transitions, right? Everything that we've been hearing about SNAP, Medicaid, the public health emergency, and all these public policies related to public health, and how things that we've been hearing from our 2109 grantees and also CHW regional networks in Wisconsin as well. So the first one is just the overall confusion and lack of clarity around these policies, around what's included, what's the new guidance all about, what's changing, what are the deadlines, where do I find the resources, right? So currently, our state is disseminating a lot of really great information and resources about it. It's just really a matter of getting those resources and information to communities, right, and to the hands of community health workers. In addition to that, we've been hearing concerns around how the social determinants of health will be impacting communities, right? That they'll be experiencing around food security, housing, healthcare, COVID prevention, right, with the public health emergency ending, which Darrell alluded to kind of earlier in the presentation. But I'm really glad that our panelists will give you a little bit more details about what that actually looks like in the community and what they're seeing with the clients that they're working with. Also, we've been seeing really great opportunities for collaboration with local public health departments. As an example, the Dane County CHW Collective, which is in Madison, Wisconsin. We currently have folks from public health regularly attend the meetings, and they ask CHWs for feedback with their messaging, the resources that they're creating, and they give updates and peer network with one another. And I think that these opportunities are really great to have that bidirectional learning and to really lift up community health worker wisdom and knowledge there in those spaces. And lastly, I'd say also that this is a really great opportunity to highlight the need for CHW workforce equity and sustainability, as CHWs are the ones that, we've been hearing that they're working primarily with the populations that are impacted by these changes. So those are just a couple of things that we've been hearing, that we've been seeing. I'm in Wisconsin as we continue talking to our 2109 partners and regional networks. So now I'll transition over to Mengxi, and I'm really looking forward to hearing from Wisconsin CHWs about what these transitions look like at the community level. Thank you all.
Thank you, Marcia. Unfortunately, one of our CHWs just got kicked out. Oh, are you back on? Okay, I see her. So I would like to introduce you all to Olga Mesa, who is a community health coordinator from Wood County Health Department, and also Penny Paulson, who is a community health worker from the Aging and Disability Resource Center from Chapala County. So I will be asking them a few questions, and then they could discuss what some of the issues that they've been seeing at a local level. So I will go up front. So Olga, I'll have you go first, and then Penny, I'll have you answer next. So my first question for the both of you is, tell us about the community you work with.
Yeah, good afternoon, everyone. So the community that I work with is majority the Hispanic Latinx community. The community that I usually help are immigrants from Mexico and Central America, who normally don't speak English, and they're escaping their native countries from poverty and government corruption. And they come here to seek for economic improvements, technically, jobs and how to feed their families and just improve their lifestyles.
Hi, I am Penny Paulson. I'm from Trumpeau County. We are in South Central Wisconsin, West Central Wisconsin, excuse me. And we are long and stretched out and beautifully rural. We are also long and stretched out and beautifully rural. There are large service gaps for folks, and I, like Olga, serve populations that are underserved, the very folks that we're talking about here. Yeah.
Thank you. And then my next question for you is, how have your communities benefited from these public health policies, such as COVID testing or vaccine, food share, Medicaid, and other supports?
Yeah, definitely. A lot of the families that I work with have young children and a large number of children. So a lot of them benefit, or any benefits is very helpful. And especially food share and the WIC programs are great to feed these families. Also, Medicare has been very great benefit. And learning from these communities, when they got approved for the Medicare, they were just exceptionally grateful because they haven't seen a doctor in their native countries for over 5 to 7 years. So just having that health benefit was, very great for them to be able to, see a dentist for the first time, or, have a physical. So these are great benefits that unfortunately are going to be ending soon.
Mm-hmm. Yeah, and the expanded public health policy around benefits has been hugely helpful here. I should, I guess, back that up a little bit by saying that I've been in my position as a community health worker for about a year. I've worked in Trempealeau County most of my life. And I thought I knew what was what. And what I find out is that I know very little and have found so many people really struggling. So I can't honestly say what it was like before COVID, but so many folks with food insecurities, with who are underinsured, who are struggling with paying their heating bills. And many of them have had additional help during this time. And I am so grateful for that. You know, one of them is my mother-in-law, who was diagnosed with pancreatic cancer during this time. And, you know, everything is a little bit more difficult when folks need to wear masks and can't do home visits. And, but ultimately, thankfully, she was served very well and has been on medical assistance now through this to help with some of those costs of treatment. The food share benefits have been hugely helpful for so many of our clients. And certainly the COVID testing supplies and COVID vaccines that we've been able to take right to the people have been wonderful because so many of those people can't come to us.
I know, Olga, can I follow up with you about testing? Because we know you worked with a lot of undocumented folks and how COVID, not testing, but like COVID-19 vaccinations, how that was structured and how you were able to communicate and connect with those communities.
Yeah, most definitely. So since I work at the Wood County Health Department, we have like certain clinic hours, office hours for vaccinations, and our building is definitely a government facility. So a lot of our immigrants are, you know, have that fear, stigma of, you know, coming to our buildings, especially because they're undocumented. So I've been in this public health in the last 3 years now. This was all new to me at the beginning of the pandemic. So I had to come up with ideas of how to outreach to this population, and how do we go to them instead of them coming to us. So then we just started being strategically and started doing clinics and events outside of our building. So we would go to schools or community centers, anywhere that I would think that they would feel more comfortable, a safe place for them. So we were very successful with this, and we started just doing them more often, like offering this type of clinic and events every other month. And so once we had a really good number of people vaccinated and that our clinics were being really successful, we needed to get more creative, because then we would have these clinics and then we were like, okay, not a lot of our communities are showing up. So what do we do different? We started doing like community events for like different holidays. For example, I believe the first one was an Easter event, you know, so we made it fun enough for the children as well, you know, and then so that once the children were getting vaccinated, it was important for us to, you know, help them feel safe, and how do we make it fun, and then provide other resources. So we would invite nonprofit organizations to come and join us, and then share those resources, and, you know, give the community information and how they can be in touch with those resources directly through them. And so that has worked really well. So we continue to do those until we can't anymore.
Yeah.
Thank you.
I know I already had my turn, but I would just say that we tried to be creative too, particularly with that population who is so isolated and shut in, to sometimes even knock on doors and offer education and means to be able to get vaccinated. So partnered with local pharmacies again to be able to go where people are. And I don't know that so much, the programming paid for everything, but people's big hearts and willingness to go into a home so that someone immunocompromised with difficulty with transportation could get vaccinated is huge. People are good.
Thank you. So my next question is, how will your communities be impacted by these policies ending and Medicaid unwinding?
Yeah, so without the health benefits, this will create a big financial burden. And I believe that it will also increase the mental health problem that we already have going. And definitely, I think children will suffer too, be impacted by malnutrition and poverty. And I can speak for myself as a community health worker. I don't have any benefits or health insurance with my employee. So I currently also have the Badger Care Forward card, myself and my children. So I'm also at stake and at risk of losing my benefits. And so I'm currently, doing job hunting and searching for a job that would provide benefits for us. So that's another thing that we've been advocating a lot for the community health workers. How do we sustain, workforce for community health workers? Because I believe that we're very valuable and that we should deserve, health insurance and benefits.
For sure. My position is actually paid with funds from a grant through the CDC. So my position is temporary. And I also believe, as Olga does, that it's very valuable. I sort of describe myself as a gap filler sometimes for folks who are underserved. And yeah, I would hope that the program can be sustainable. Outside of myself, already in this very short time, we're seeing people really struggle with food insecurities. Folks who were receiving the increased allocation for food share to no fault of their own, of course, lost that benefit pretty abruptly. And I think, like so many of our population, they had the information. They maybe even read the information, but they didn't get that meant them. And so $23 a month does not go very far for groceries when someone has been used to so much more. And not having had to do reviews was a huge blessing for so many of these programs in the last 3 years. But many of our clients have never done a review. They're very overwhelmed and almost frozen, almost paralyzed by the unknown and lack of security in the future. Pre-COVID, depression and anxiety, I think, were the #1 disabling diagnosis worldwide. And I believe that the World Health Organization estimates that there's been a 25% increase since. And we're, out there working with healthy ideas and trying to help people take action to reclaim their lives. But yes, the increased anxiety and fear and almost paralysis that we see around these unwinding benefits does not create a calmer, healthier environment for the folks that we serve. It's chaotic and fearful.
Yes, Penny, I agree with you. I just like to mention really quickly is I still work for, I still do CHW work as well, although I'm with Envision. And I just want to bring it to people's perspective that for one client that I work with, they were receiving about $200 for food share. And in this past March, with the renewal process and everything, that family is only getting $15 a month.
Yeah.
So the drastic change is, it amazes me, you know,
Sure.
it's very unfortunate to be seeing this
Mhm.
with our clients as we go forward, you know. Mhm.
And as some of these things are unwinding, you know, the clients I was speaking about have a pretty similar experience financially, but they've also been benefiting with the food pantry, being able to go to it. Well, with the unwinding, some of those food pantry sources have brought some of their requirements back as well. So now needing to show proof of eligibility, proof of expenses. And again, so many of our folks, the couple I'm thinking of right now, just are not able to do that by themselves. And so the last 2 months, they've not been able to go to the food pantry either. They've been turned away. And they're just, you know, one small piece of this puzzle.
I just wanted to mention really quick before we move on to the next question. I know they mentioned earlier, like, you know, if you don't qualify or, you know, for the renewal, that there is a marketplace, but I know that I tried that myself in the past and honestly it's really expensive. And it's not culturally appropriate for the community that I'm serving because you do have to be a citizen to, you know, be approved for that. So just also wanted to mention that.
Thank you so much for those stories. And I think that's what is driving like CHW, you know, to really advocate for our communities, is seeing things like this. So my next question is, what is being done at the local level or for the community to raise awareness about some of these changes? And if there isn't anything, like, what do you wish could be done?
Yeah, so we are preparing for it by learning more about it, like attending webinars like this, like today. And we are taking action plan as a team to move on to the next step. As a community health worker myself, I will continue to find resources and connect the community to those resources. One of them that I always keep, you know, behind my head is Family Health La Clinica. They just opened up a new location here in central Wisconsin, which is so great because it's in the middle of the community that I assist. And they're a community-based organization that provides medical care at little or no coverage to low-income families. And people who are uninsured or underinsured individuals also get this assistance. So that's something that I have so far that I can send them to.
Yeah, we've also been doing a lot of education using the information that's provided to us through public health and DHS. And in addition to putting that information sort of out there in print, we are sharing that information and having sort of community talks at senior meal sites so that people have an opportunity to ask questions about what that means. We're posting the information on Facebook as well, and our disability benefit specialist and elder benefit specialist are doing a lot to educate people around what to expect, what to watch for, what to do. And if you don't know what to do, ultimately, if people don't know what to do, call us. We will help figure it out. Don't do nothing. And it seems like right now there's been an increase in, I don't know, fraud, opportunistic ventures to take advantage of some of our seniors and disabled folks. So it maybe isn't intended that way, but right now, many Medicare Advantage programs are sending notices out to clients who are duly eligible saying, you need to call us or you're going to lose your insurance. And then through that, the documents, the mail that people receive, there's a pretty intense pressure there to sign up for a program that people maybe don't even want or need out of fear and a lack of information. So again, just trying to help people sort through that. I wish it could be more. And we'll keep doing what we're doing. We did a health fair here locally recently, and there was a lot of engagement from folks in the community around some of those very questions. So we're also sharing information with our home delivered meal recipients, and doing the best we can.
Thank you, Penny. I just wanted to end my statement by saying that the most potential impact and increases will be like chronic illnesses, such as like hypertension, diabetes, obesity, mental health, and more.
Absolutely. And another of the things that we're doing, I guess, is trying to provide information to people about free clinics and free or reduced price options to be able to help with medications, basic healthcare, very basic healthcare, so that those chronic illnesses can be taken care of. I think people lost ground in the first couple of years of COVID too, and really maybe didn't see their primary care provider, didn't have updated exams, and we saw some folks decline perhaps for a number of reasons. And just now, as they're sort of reclaiming their lives and getting their health back on track, there is this like major jolt for so many of them again. So yeah, you're right.
Yeah. And definitely some barriers that they will be facing is like, a lot of the immigrants that I work with don't have license, so they can't drive. Or don't have enough money for gas to get from point A to point B, because we are in a rural area. So those free clinics can be about 45 to 1 hour away. And then not being able to speak English as well. So there's so many barriers that come in with this as well.
Yeah. You're right, Olga.
Thank you
Thank
so
you.
much.
Do you have any more questions?
No, that is it. Is there anything else y'all would like to share that I may have missed with my questions?
I don't think so, but thank you so
covered
much
it.
for this event.
Thank you so much for, all the information that you are sharing, because it's really great to provide content of what's going on, but it's also really important to highlight what is going on, boots on the ground work, like what are you really seeing out there in the community as well. So we wanted to bring that perspective to our audience today with Medicaid and SNAP unwinding, and just is a lot of policy changes. So I would like to thank, Penny and Olga one more time for the great discussions and testimonies that you both, have shared with us, and also the resources and the information that Marcia, you also shared with us as well. So thank you, all three of you, one more time. And then we could go back.
Thank you for the opportunity.
Yeah, we could go back into sharing the slide again. We do have time for Q&A. So for individuals that want any, that have any questions for all 5 of the presenters, please put it in the chat. And then we do have, Marcia, can I have you, because you've been in charge of the chat, can I have you come and kind of facilitate the Q&A section?
Yes, I'd be happy to. Okay, so we have 3 questions, and also please drop in any questions as well that you might have. So the first one is for our earlier presenters, I believe, asking do you have any information about coverage and changes in territories?
So I don't have anything off the top of my head. I know at least the timelines that CMS released, Puerto Rico and the other territories are included. So you can see the timeline for when they started their redetermination process and when terminations would begin. I will say for our 50-state tracker on of unwinding information for CCF, we have tried to find information from the territories and have not been able to find anything publicly available. So if you guys come across anything, would be happy to post that on our website. But unfortunately, there doesn't seem to be a lot of publicly available information.
Thank you, Ali. If you do see anything, likewise, let us know and we'd be happy to post it as a resource. But yeah, thank you so much for your answer. So we have another question that says, I would like to know more about Marketplace. What type of insurance is available there, eligibility, and if there's any other way individuals can find affordable health insurance besides the Marketplace.
Great, thanks for asking that question. I put a link in the chat to a website that we run out of CBPP known as Beyond the Basics. And that has tons of webinars, information, flyers, all kinds of stuff about accessing insurance on the Marketplace. A lot of it is specific to the healthcare.gov, the FFM, but a lot of the information is also relevant if you have a state-based Marketplace. I encourage you to check that out and feel free to contact us if you have any specific questions. There are enhanced subsidies on the Marketplace that make it even more affordable than it was before. So I know people might have had some challenges before with the affordability, networks and things like that. I encourage you to check it out again. It is even better than it was before.
Thank you so much. We have one more question for you two, and one question for one of the CHW panelists. So that question is about if you two could perhaps elaborate on how we can watch out for scams. What do we do if their client or themselves get scammed with anything related to the Marketplace or health insurance?
I think, just communicating to the public about and to your clients about the fact that no one will ever ask you to pay for something. Some of the scams we've heard is folks calling and saying, we'll renew your Medicaid, but you have to pay $500. In some states, we know there are premiums, so sometimes it's hard to kind of distinguish a small premium payment that might be required from another payment. And to just kind of use the due diligence that we all use, watching for scams. If they're asking you for personal information, you shouldn't provide it. If something feels a little funny, call the number that you know for your local human service or health agency, things like that. And we are really excited that a lot of states are using text messages to communicate more than ever before, especially with folks with unstable housing situations. That can be a really great way to give them information. But that also opens the door to scams as well. And so we're trying to figure out how to make that as effective as possible without allowing scammers to come in. But once again, if something feels funny, you don't click the link. You go to My Access Wisconsin or whatever the website is that you know. Ali, anything to add?
The only thing I'll mention is I know this is on this radar of a number of states as well as CMS. And so I'll put in the chat in just a second. A few states have gone ahead and put out like press statements or just an awareness message on their website indicating, here's the scams that we've seen. This is incorrect information. This is the place. If you get any contact from the state agency, this is who it'll be from. And so some states are preemptively, as these scams have become more prevalent, trying to get ahead of those. And so I'll put some examples in the chat.
Thank you so much, Ali and Jen. Really, really appreciate your perspectives, and definitely scary, right? Penny commented that recently one of her clients paid all of Social Security income to a scammer, which is so scary to think about. So we definitely have to make sure to watch out for that. And thanks again for sharing the links. And actually, this question was answered in the chat. Somebody was wondering, or Sherpa was wondering about the population that Penny was working with, and she responded that Penny's located in the Aging and Disability Resource Center of Trempealeau County in the western side of the state in Wisconsin. Their office is in Whitehall, Wisconsin. We are all things senior, aging, and disability. Anybody else have questions for our lovely panelists or Ali and Jen? Oh, there's one right there. North Carolina has recently decided to allow CHWs to serve and sign up citizens for Medicaid. Have any of your states started using CHWs for this?
I could answer that question for where I'm at in central rural Wisconsin is we do have some community health workers who got certified to become health navigators as well. So we do have community health workers working as health navigators to help. I know it's like it's not limited to Medicaid, but they do help with Medicaid enrollment as well, and just the marketplace enrollment as also.
Hi, I'm from Oklahoma, and our CHWs that are embedded in our county health departments are helping our clients with Medicaid enrollment.
And I'll say, you know, and looking across and tracking what states are doing, I know a number of states have tried to develop these kind of sister programs to include community organizations in helping assist people through their redetermination process. And so I would encourage you to try and figure out if you're not already involved in that process, trying to see if your state has it, and if so, getting involved. Two that come to mind that are not necessarily doing outreach to community organizations, but these sister programs do exist, are Arkansas and Texas, which are obviously big states, and Arkansas has already started termination. So just flagging those two.
Thank you so much. And Maya was asking if you have any, if you all have any information to please email her. She put her her contact information in the chat. And I think we have time for one more question. If there is a specific training for CHWs to allow to do the enrollment. And Gretchen, yeah, Gretchen made a comment. Yes, it would be great for CHW trainings on Medicaid enrollment and applications 101. And wondering if there's a training that you've seen for CHWs.
There are a number of policy trainings around Medicaid, and Georgetown has a number of good ones, but I think that would be a state-specific issue. So I encourage you to reach out to your navigators and assisters to get, there might be something in your state that specifies what your policy is, and also helps walk you through like the website and how you might sign client up and navigate that. So the policy is fairly consistent nationally, but the actual kind of process and who to call and what documents are necessary, that tends to be a little bit more state specific. And in most of your states, I would assume that there's a navigator or a sister organization or somebody else that might do that regularly.
Thank you all so much. I see that there was a question in the chat that was answered by Ali about the timeline. So thank you all so much. Now I will transition us back to Mangshi. And again, thank you so much to our panelists and Ali and Jen earlier.
Thank you everyone for joining us today. And I think the content that we had for today was really informative and really current to what is going on right now. And, you know, one last time, I would just like to thank all the presenters and co-facilitators, and also the attendees for staying on this long to listen in into our webinar. So thank you all, everyone. I hope you all have a great weekend, and we'll see you next time.